Welcome. Good to see you all. Thanks for joining us. Hey, Ken. Hey, William.
Good afternoon, everyone.
How's it going? Where are you all hailing from? Where are you zooming in from, Ken? Hey, William. Where are you? Where were you?
I'm in Sacramento, Brian. I'm in Sacramento.
Oh, fantastic. All right. That's cool. And we got, Phoenix, Arizona. Okay.
Phoenix. My
West-
partner was just visiting their family in Scottsdale. They just got back a couple days ago.
Where are you, Ryan?
I'm in Minneapolis, Minnesota. So we've got snow on the ground. I'm guessing that's not likely for any of your all's environments. Although, Robel, can you see snow in the mountains? Robel's
Yeah, they're definitely, if you go out on the highway, you can see the snow tops. I live out in Denver, Colorado. So we still get some sporadic snow here and there this time of year, but finally lessening a little bit.
How have you all been enjoying the conference so far? Anything that you found kind of super interesting or informational as you've been doing it?
I thought the technology was just awesome. I mean, those two people just created this amazing functional technology of our accessibility, and shifting into small groups like this seamlessly is just gorgeous.
It's kind of amazing that it all works.
It's
Yeah,
really, really super. I wish I knew somebody that had that kind of competency.
That's so cool. What about you? What about for you, Ken?
He's muted.
Oh, I see. Yeah.
Kenny, you're muted.
Maybe he's
Okay, I'm unmuted.
okay. Got it. Good to meet you. Good to meet you. How'd you all? Is this the first time you've been to this conference, or are you all frequent flyers?
I've been to many of them, mainly in person.
Okay, cool. It does seem like it would be nicer to be in person, but safety first, I guess, is a good way to go too. How about you? How about you, William?
This is my first time, but I've been organizing for 40, 50 years in this. I'm coordinating. Just a minute, something's wrong here. There's huge feedback for some reason or another.
Yeah, I think it was just the mute loop on Ken's computer. So not intending to silence you, Ken, but I just muted, and feel free to unmute when you need to jump back in.
I've been organizing a group of about 40 people from around the country to create a thing called the California Lifetime Healthcare Act, which is a policy model, world-class policy model that contains all of the major issues that have to do with democratizing the system, expanding the governance structure, buying out all medical debt in the country, global budgeting for all student tuition and healthcare training, and so forth. The website is caltcha.org.
Okay, I'm going to check that out right now.
And it has to do everything with this whole theme of care rather than focusing exclusively on cost.
Oh, that's amazing. I'm clicking it up right now. How'd you get into that, William?
I'm an organizer. I've been doing this all my life.
Yeah.
I recently wrote a book called Public Hostage, Public Ransom, Ending Institutional America, which is a spear in the chest of Medicaid. It has to do with the federal class action lawsuit that we coordinated for crimes against humanity against the governor of the state of New York for running this monstrosity called Willowbrook State School that Geraldo Rivera did an expose on 50 years ago. The book just came out, and it all focuses on the need for universal single-payer healthcare to end Medicaid.
Mm-hmm. And this was in the book that you're referring to. Was it about essentially the kind of problems of the institutionalization of people, or different than that?
It's a narrative documentary with 80 photographs, 380 pages altogether, of the struggle to shut down Willowbrook, this monstrosity, but to take on the whole state in relationship to having to do that. And we had to go to the federal court. But the book is very powerful and deals hammer blow on single payer healthcare, the need for that as a way of ending institutional culture in America. All of us, as we age, are winding up aiming towards institutional terminus.
Meaning like an institution's going to get us at
Exactly.
some point. It just
Exactly right. So there are wonderful references inside the website of places to go to really look at models that deflect that terminus.
Yep.
Anyway,
Cool.
go ahead. You know, you've got a workshop to run here.
Yeah. We'll just get started in 2 minutes or so.
I see Beverly raised your hand. You want to unmute and share with us?
I was just going to ask Mr. Bronston if he could like maybe type in the title of his book in the chat or something.
Sure,
I didn't catch the
sure,
title.
absolutely.
I'm a librarian, so I'm always interested in books. So thank you. Retired. Thank you.
Where are you a librarian at, Beverly? May I ask?
I've been a librarian since I worked as an assistant since 1989. I got my degree in 1995, but I was working in Florida.
Okay.
Then I moved to Maine, and I was, so librarians once you have a degree, you can do all kinds of library work. So I've been a children's librarian. I've been a public safety librarian. I have been a law librarian, and I've been a public librarian. So
Wow.
I've worked in a lot of different environments, but
Yeah,
I had a very good education. So I'm able to have that flexibility.
That's cool. All right. Well, welcome to other folks who are joining. I see Melissa, I see Peter, I see Faith. Welcome you all. We'll be getting started in just a minute or so. As we're joining in here, thanks for joining this Care Over Cost workshop. It's going to be about how we're going to organize folks, or one strategy to organize people who are harmed by private insurance as we build a bigger and deeper base of folks fighting for single payer and Medicare for all. Maybe just because it's 15 after the hour, I've been in one of these before where folks had joined, but maybe we can start by introducing ourselves in chat. I just posted a kind of a template in chat where folks put down their name. If you have gender pronouns that you like to be referred by, you can put those in there. You don't have to, but some people might scan one way and prefer to be using a different gender pronoun, and some folks are using they, them. So want to say if your name, you got a gender pronoun you prefer, where you're from, and if you're connected with an organization, what that organization is, and maybe just a sentence on why you signed up for this workshop. What about this care over cost fight and organizing people harmed by private insurance? That strategy kind of popped for you all. So folks in chat, just as we're getting started, can put in your name and just any gender pronouns you prefer, where you're from, if you're connected with an organization, and why you signed up to this workshop. That'd be great. So we'll just go into chat, and I may just call on a couple of people. I don't know that we'll be able to go around the whole room, but I'm going to call on a couple of folks to model. I see Heather, who's she, her in Iowa. She's with the awesome organization Iowa CCI, looking for new ways to have conversations with people who have private insurance. All right, welcome, Heather.
The right place.
You came to the right place. Let's go, Iowa. I see Beverly with Rights and Democracy, another awesome organization in New Hampshire, takes she, her pronoun. Beverly, can I ask you, why did you sign up for this workshop? What inspired you about care over cost?
Well, I was actually in my other breakout room talking about how because I've always had to have health care. So a lot of my career choices have been driven towards getting a job with health care. But recently, because I'm approaching the age of 62 and I lost my job in 2020 right before the pandemic, and my husband's been carrying it. Suddenly the costs have gone out of the roof. Like we have a $4,500 deductible, and I suddenly have reoccurring health issues as a result of that accident I had when I was younger. And it hasn't been fun. I have a lot to say about that. I need to write it out, but like I said earlier, it feels like I'm being sold, and I don't need to be sold. I just need my health care.
You just need
Yeah.
healthcare. Yeah, it goes exactly to the point that William was raising for folks who are kind of on earlier. Seeing other folks sign in to chat, so folks can say their name, any gender pronouns if you'd like to be addressed by, where you're from, if you're connected with an organization, and why you signed up for this workshop. I'm seeing Ken in Arizona. Welcome, Ken. Patty in Massachusetts. Welcome, Patty. Faith in Asheville, North Carolina. Welcome, Faith. And Stefan or Stephen, who's MFT in the East Bay, therapist for single payer. That's very cool. And seeing William is on the steering committee for physicians for a national health program. We got Patty from Humboldt County. I'm guessing that's Humboldt, California. Welcome, Patty. Welcome to this. And we've got Walter. Maybe I'll ask you to unpack, Walter. Can you tell us why you signed up for this workshop? What motivated you about this idea of organizing people harmed by private insurance in the Medicare for All fight?
You mean you want me to speak?
Yes. Yeah.
Come on, man.
Take a couple sentences. What inspired you to sign up for this? Yeah.
Well, I'm inspired by single payer. I've been fighting for this almost as long as Bill Bronson has, and we're longtime members of PNHP, so I've been fighting this since 1990. Just to give you an idea.
Awesome.
And I was hoping that it's going to happen during Quentin Young's lifetime, but I'm hoping it will still happen within my lifetime. So, I'm encouraged by seeing younger people joining the fight all the time.
Quentin coined everybody in, nobody out. That was Quentin's logo.
That I have chanted that, so I'm gonna name check Quentin when I do it in the future, because I've definitely chanted that. Well, great to meet you all. I'll introduce myself since I've been talking here, and we'll dive in to this organizing. So my name is Ryan Greenwood. I use he, him, his pronouns. I'm based here in Minneapolis, Minnesota. I grew up in a small town about near the Iowa border. I saw there was an Iowan in the house. And I'm on the People's Action National Staff Team, organizing on our Healthcare for All team on this Care Over Cost campaign, which is our strategy to confront the private insurers with their wrongdoing and to organize a bigger base of folks who are harmed by private insurance. So that's me. I'm just a quick personal story that kind of brings me to this fight. I was told, I was told I had good healthcare for years, Blue Cross Blue Shield, right? Like as good as you can get in the system where, I wasn't paying premiums, I wasn't paying a deductible, I had full family care. And so I thought it was great. And then I got hurt. I was screaming in pain. And my wife dialed 911 on my behalf. First, the firefighters came. They come, they check me out. They say, we got to get this guy in an ambulance. And then an ambulance comes. They take me to the hospital, spend hours there, they give me the medicine I need. They patch me up, and they send me home on a path to a recovery that would take about a month. And I thought all was well, that ends well. And then I got the bill. And it turned out the ambulance company in my hometown was out of network. And you couldn't dial 911 without getting an out-of-network ambulance company if you were on Blue Cross Blue Shield. And I got stuck with thousands of dollars in bills. They then shifted me to a medical debt collector, and I started getting the phone calls. Fast forward 3 years, I'm now a young parent, and I get injured again in the same town. This time it was in public. A passerby called 911 on my behalf, thankfully, and who should show up but the same ambulance company.
Oh.
And I had to think for myself, am I going to get into that ambulance? Am I going to cost my family thousands of dollars in medical debt? Am I going to deal with collectors? Or should, screaming in pain, I just try to organize somebody on the street to drive me to the hospital? Nobody should have to have that choice in our lives.
Really?
And I think that's a perfect example of health industry profiteering and the health insurance industry putting their profits or costs over our care or over patients. And so that's one of the things that motivates me to fight back. I'm going to pass it to my co-facilitator for this section, Robel, to tell a little bit about himself, and then we'll dive in. Take it away, Robel.
Hey everyone, my name's Robel Worku. I use he, him, his pronouns. I'm also with People's Action on our healthcare team, Healthcare for All team, as a lead organizer. A little bit about me. I was actually, I'm a Canadian citizen. I was born in Toronto, and that's where my father still lives now. And then I grew up in Atlanta with my mother, or kind of in Georgia in some different spots. Covington, if you know the area, it's a little farther out, and also within the city as well. And so I've kind of experienced a litany of things within the healthcare system. My father is, is an older man. And so it's been very fortunate for us and our family that he's been able to receive the care that he needs up in Canada, where they have a single payer healthcare system. And, you know, he's been frank with me that if he's dealt with some of these things in the United States, it would have led to financial catastrophe for him. And so I just, from that standpoint, it has always felt deeply unfair to me that not everyone has that access to care. And that's solely premise off the fact that folks want to profit off of our bodies. On the other side of things, my mother, for most of my life now, has worked in the breast cancer clinic in Grady Memorial Hospital down in Atlanta. It's one of the largest public health hospitals in the country, and also primarily is the health provider for the houseless population in downtown Atlanta. And so just kind of watching her navigate like those situations with folks, in addition to folks within the breast cancer clinic who would be rationing their care because they couldn't necessarily come in to afford, couldn't afford their appointments and their treatments. And so being able to kind of see all these different things, and then having kind of my own experience with private insurance. I used to, a former job of mine had a Kaiser Permanente. I had a situation where took them a long time to figure this out, and I was a lot of pain in the midst of it. Intracranial hypertension. It's this kind of spontaneous condition where you get like a leak of fluid from your brain coming into your back. And so what ends up happening is that your brain starts sagging lower in your skull. And so what happened to me then was that anytime I was upright, I was just in an immense amount of pain. I couldn't really do anything besides lay on my couch. And so, there were kind of a set of different experiences I felt there. One was when I went to urgent care, and I had a doctor trying to convince me that this was just a migraine. I just needed to take some medication and go home. And that wasn't the case. But then in the search to kind of figure out how to get this treated, once we kind of more narrowed down what the issue was, I needed to see a specialist. I needed to go to a neurospecialist and get a couple of particular procedures to kind of get my, I don't know all the words, my skull fluid levels kind of back situated to be able to do anything. And so that whole time, it was just a situation where, I just knew I was being severely incapacitated. And so my only concern was like, y'all tell me I need to go see the specialist. I'm going to figure out how, this out however I can, because I'm just in immense pain in every hour of the day. And so we did that, and we're fortunate. At first, it might have been 2 months before I could see somebody, but there was a cancellation. Someone was able to see me. So we kind of go through this whole process, and, I think everything's good. I feel great after my couple of treatments. I'm, trying to move on with my life. And then similarly to what Ryan shared, the bill started coming in. The collectors started calling me. It was just a very overwhelming experience for me as a young man, kind of being out in the world on my own, like, those first few years out the house and such. And so having like these collectors calling me and trying to figure out, like, kind of call back with Kaiser Permanente and figure out if they would cover this. The answer was no. And so it's a situation where, I want to be financially stable and kind of set myself up in different ways, and feeling like, I'm still kind of climbing out from that situation that was really about desperation for me and my body. And that, it just feels unjust to me for me personally, but also just understanding that there are just millions of people who go through these situations every day that feel like they have adequate or even great healthcare coverage until they reach this point. And like, we want to build something that gets folks to understand that, like, you shouldn't have to experience this to understand that your private insurance company doesn't hold your best interests at heart. And so I'm really glad that everyone's here today to talk through this campaign with us.
Thanks so much, Robel. And yeah, we wanted to share with you all a little bit about the personal stake that brings us to this fight. We know that you all probably just individually as human beings, or those of you that have been workers and making people healthy, physicians, nurses, CNAs, et cetera, have seen those experiences with your patients or in other people we love. And there'll be chances throughout this for you all to share. And yeah, just to shout out what William put in chat. I mean, Robel's story and having a dad who lives in Canada is a perfect illustration. All that stress happens because of the system that we set up here in America, and it doesn't have to be like that. So I'm going to give a little bit of background on us as People's Action, and then we're going to dive into this care over cost strategy and create some time for you all to give feedback on it. And we'd love to ask for you to get involved. That is going to be our pitch at the end of this. So quick background on People's Action. We're a nationwide movement that unites million members of 40 state and local people's organizations from Maine to Los Angeles, from Washington State to North Carolina. We unite Black, brown, and white working class people to win an economy that puts people over profit and one that advances racial equity. That's our mission in life. And a couple of the folks on the call who name checked their organizations in chat, Rights and Democracy there in New Hampshire and Iowa CCI there in Iowa are some of the awesome member organizations of People's Action. We've been around for about 40 years through our predecessors and have won major changes, including spearheading passage of the Community Reinvestment Act, which forces banks to reinvest some of depositors' money in low-income neighborhoods, back in the same neighborhoods that people were making their deposits in. Essentially, it was organized out of a base of folks primarily on the south and west side of Chicago, who are sick of seeing their deposits go to build up wealthy white areas instead of being invested in their same community. Recently, we ran 3 forums with presidential candidates in Iowa, New Hampshire, and Nevada, including centering Medicare for all. And we eventually backed Senator Sanders for president. One key plank of our work is called Care Over Cost, and that's this campaign to organize people harmed by private insurers that we're here to talk with you about today. So I'm going to pass it off to Robel to kick us off, go more through the agenda and a little background on this strategy.
Sure, and I just need to share my screen. Give me one moment. Oh, apparently I need to give Zoom permission first to do this. Give me one moment, everyone. Actually, apologies, Ryan, are you able to share your screen? I'm running into some issues here.
You should be able to now. Can you try again?
Yeah, I'll try it once more. For whatever reason, I'm unable to select Zoom to give it a privacy permission on my laptop.
I can grab it on mine. I'll just do it here, and we'll triumph over laptop security.
All right, here we are. Okay, so the agenda for today's workshop. So first, we want to give an overview of how care over cost strategically plays into the long-term fight to winning Medicare for all. In addition to that, we want to talk through the campaign plan and how that ties into Medicare for all as well. We want to talk through the issue of claims denial. So that's part of the things that both Ryan and I were speaking to. We thought we had adequate insurance. We came up into this thing that they didn't cover. And now that leads to some financial situations for us because we weren't able to get our health insurance providers to provide those services for us. So we want to talk through that problem and talk through our strategy within this campaign for how we want to fight back on that. And then we want to open this up to give folks avenues to be able to participate. So we'll share some information about what are some of our next steps and how folks can get plugged into that. And then we want to hear from you all too. And so, everyone is coming to this workshop with their own kind of set of experiences around health insurance. And so we want to hear from you all, both personally, how do you feel like this has impacted you in your life? But also we just want to hear from you all about what do you think about this strategy and how Care Over Costs, this campaign, plays into our fight for health justice. So healthcare for all. This is the name of People's Actions healthcare work, Healthcare for All. So it isn't solely for us about Medicare for all, though we do see it as a large and clear plank of this fight. But we see health justice as also encompassing work around racial equity in healthcare, some of which might not be solved by Medicare for all alone. We also want to work on targeting big pharma and medicines, folks that are, taking life-saving drugs and hyping the prices on them up so much that folks can't afford them. And then we have a separate, program within People's Action called Justice is Global that is working to ensure that, we are winning access to vaccines globally, because right now folks are profiting off the vaccine for one, and two, limiting access to folks that need that around the world. Then we can go to the next slide. And so, previous one more, there we go. And so our stance around these issues, we want to take back control of our healthcare from corporations and CEOs that have used our bodies and our health to enrich themselves. We're fighting for an improved Medicare for all system. And a piece of that is that we have to directly counter the racialized villainization of public health programs like Medicaid and block every attempt to repeal and weaken the Affordable Care Act. And then undergirding all of that on a top level, narrative-wise, we need to challenge anything that says any person is undeserving of care, because all of us know that isn't true. And we've also got to realize that, make true American Indian sovereign treaty right to healthcare. So through all that, we come to y'all here today to talk through our Care Over Cost campaign, and Ryan will take it over here to talk through some of that with y'all.
Awesome, thanks, Rubel. So let's just start out with the easy part that I think should get our juices flowing. Can folks place in chat, which one of these companies puts their profits, puts cost over your care? Let's put it in chat. Who puts, which one of these companies? Is it Anthem? Is it Blue Cross? It was Blue Cross Blue Shield of Illinois for me. Anthem for Aisha. All of them do it. That is right, Heather. Looking for individual impact. I'm seeing Beverly, shout out Cigna. BCBS is the one that Ken encounters. Kaiser for Nathan. I know we've got some, especially in the West Coast, that's a big one. United for Faith. Providence in Oregon. Blue Double Cross, United Stealth. Yep, well played. Ken, United Health. I'm just going to ask one or two people to come off mute. Faith, would you be willing to just say, hey, in your experience, what's just one example of the way in which United put costs over your care, put their profits over you as a patient?
I can say it's happened personally and professionally because I'm a psychologist. United's one of the worst. They don't cover mental health benefits very well. They deny most of the claims, and you have to keep submitting your claims. But yeah, for me personally, I have type 1 diabetes, and they tried to deny me care from my endocrinologist, who I'd had for years. And when I switched to their plan, they said I didn't have some kind of prior authorization to see him, and I had to. Anyway, I fought very hard and won. So, yeah. Wow.
Can I ask, how did that impact your life, having to fight that hard?
It was exhausting. I mean, it wasn't just that. I mean, I usually, when I had them as my insurer, I spent several hours a month on the phone with them. It was ridiculous.
Wow. So it's both the impact, and then there's the emotional impact, and then there's just the sheer amount of time that you have to spend engaging with these people. Our daughter went through a cleft palate surgery, and in following up on that surgery, there's just a series of kind of checkups and medical interventions she had to go through, and it's like from our family's standpoint, it feels like, oh, you're always having to escalate with Blue Cross Blue Shield to get the response you need. Let's unpack from one other person. Can I ask Patty, your experience? And I believe you said in the chat you were a nurse as well. So it could be personally or professionally. How have you seen Aetna put their profits over patients' costs over your care?
Sure. Actually, it was a toss-up between Cigna and Aetna, and I'm a nurse case manager, which means I battle with the insurers all the time to get them to cover patients who are in the hospital and have, certain needs. And I would say Cigna in particular, well, Aetna, both of them really, I could call them for 3 days and not speak to a human being to get an authorization while the patient has to stay in the hospital. Actually stay, we don't know if they're going to pay, stay because we don't get authorization for them to go home on an expensive medicine. They're just the worst to deal with. So many patients have gone without care because we can't even contact them, and they're closed on the weekends.
It is incredible to think about the billions of dollars they make in profit, all to essentially set up a bunch of mechanisms to prevent people from getting access to the care that they need. And you're seeing it in hospitals with people having extended stays because they can't get the medicine they need to go home. And Faith, in your example, I'm imagining we've seen this happen with other people as we've done this outreach, that they need access to medicines or other support infrastructure for their mental health, and a delay is toxic for their mental health. And yet delay is what they get from the insurance companies. Pretty easy principle, knew it in this crowd. All of these specific organizations are preventing us from getting the access to the care they need. So, one of the things that we believe as organizers philosophically is we got to take that personal pain, that private pain, and convert it into public action. And that's going to be especially key in this fight, because if we think about them as an aggregate problem to preventing Medicare for all, they are like our giant strategic barrier, right? So this is just, and I'm sure you all know this statistics well, being in the movement, but we should just absorb them. These are just their profit increases from 4 of the private insurers in the start of the pandemic. So United Health Group, which is based 11 miles from my house here in Minneapolis, they made $6.7 billion in just the first quarter of the pandemic. They made $17 billion in total last year in 2021. On down to Anthem, Blue Cross Blue Shield, $2.3 billion in profit just in that first quarter of the pandemic. And so they're a giant strategic problem for us, because as they spend stunning amounts of money buying our political system. And they can do this, and they do this because that is their entire strategy to exist. So they charge too much money so people can't afford for their healthcare, and they fail to cover care and medication our communities need, and they use it to stop efforts from us to push back against them. They put their profits over our care, right? So, okay, what are we going to do about it, or how do we think about it as an obstacle? The second piece of the equation for us is that, most people in America, as you all know, still have private health insurance. 66.5% is one recent stat. 70% of those people with private insurance think they have good coverage. Now, we all know that, and that even just in this one random survey, that's less than Medicare, but that's kind of a problem for us. Because if the majority of people have private health insurance, and the majority of those people with private insurance think they have good coverage, then people as voters are inherently conservative. They will be open to lines of attack that say things are going to get worse for you if you support Medicare for all or another single payer system. And we as Medicare for all activists, we can list tons of policy reasons about why that ain't so. But I think what we need to do, our kind of concept of this strategy, is that we need to elevate the stories of people who have private insurance and have been harmed by it. Because that 70% is mostly made up of people who think it's good because they haven't had to use it. They haven't gotten hurt and they haven't gotten sick. And our ability to base build and tens of millions of people to stay strong in the Medicare for All fight is going to be equivalent to our ability to base build within this universe of people. So we think it's a key strategy to win Medicare for All, organizing people who have private health insurance, elevating the stories of people who are harmed by private health insurance. So, and when we think about the goals, like when we think about this as like a strategic planks to win Medicare for All, we think there's like 3 steps. Number one, we want to win real improvements in people's lives now within the current system. Now, I think probably in a room of Medicare for All and single payer activists, this may be the point that has the most tension, because of course, we know that any reforms we get in the current system are going to be a no match for the murderous nature of the system itself, right? At the same time, people are suffering now, they need some relief now, and we need to prove to people that organizing can work as a means to create change. Otherwise, we're not going to be able to expand our base of single payer activists and supporters across the country. So we want to win real improvements in people's lives now. 2, we want to elevate the stories of harm caused by private insurance. And the way I think about this is we need to make even more toxic the health insurance companies' brands. Now, of course, they're toxic to us as Medicare for All supporters and people who have been thinking about this work for years. But to the average person who sees the advertisements, who hasn't gotten hurt or sick yet, they could think, oh, maybe Anthem is there for me. And I see their advertisements, I see them talking about the good they do in the world. Maybe that's partially true. So we need to toxify their brand by elevating the real stories of what happens when you get sick or hurt. And then number 3, we're going to pivot along with many other organizations represented here at this conference into a patients over profits pledge to put pressure on politicians to stop taking health insurance industry money and to stop health insurance companies from giving politicians that money. Ultimately, we want to make it a political liability for politicians to take that money. And we think that flows also from the harm that we would cause or the stories of harm. So this runs through the steps in the process. So right now we're reaching out to 800,000 people across 7 states to find people harmed by their private insurance company and who are willing to take action. We're using a bunch of different methodologies. We're texting people, we're calling people, we're knocking on their doors, we're showing up at physical events, everything from farmers markets to malls. And we're setting up, in the case of folks in Iowa, are essentially setting up a hotline for folks to call when they've got harmed by their private insurance company to kind of act as a big net, grabbing folks who are willing to take action. That's one of the things that we're going to ask you for help with, is doing that outreach. Number 2, we're going to be going public with those stories to illustrate insurance company harms to the general public. So it's not just, we do story sharing meetings. We've done these in Illinois and other places where folks come together, say, like, as a group of 25 people, how have we each individually been hurt by an insurance company? Some of the stories that Faith and others were sharing at the beginning of this meeting. And we find that for people who were suffering alone, who maybe haven't been a part of the Medicare for All movement, who maybe haven't been kind of involved in community organizing, they feel very alone. And they feel like maybe I made a mistake, or maybe there's some reason I am not getting what I need out of this system that's individual. And so getting people together makes them realize that it's a collective problem that needs a collective response. So we'll go public. Some of those actions to go public will be social media, earned media, and some of them will be literally directly taking confrontations to the insurance companies. Occasionally, because we've got an active claim denial appeal and we think that additional pressure would actually work. And equally, because the insurance company is a foil that we can then use to kind of push out through earned media or traditional or social media the stories of harm. Specifically, within this, we're finding people with denied claims or pre-authorization denials to help them appeal. The reason we're doing that is, we'll get into a second, but we think that that is one concrete step people can take to jam the system, because we think that the insurance companies are way over denying care, even in violation of their own summary of benefits. And finally, number 4, we're going to pivot to the patients over profits pledge that so many of you all are working on, and directly intervening with political class to demand they stop taking health insurance industry money. So this just covers a little bit of like what that looks like to pressure insurance companies. Some of it is just the traditional letters to the editor, op-eds. For example, Beverly with Rights and Democracy, one of her comrades there got an op-ed into a local newspaper talking about the problems they had with their insurance company. We want to jam the insurance company inboxes, call and email, and social media thunderclaps, and demand group meetings with local executives and elected officials. And then finally doing kind of direct actions at the corporate health offices. We've got a strong tradition of doing this at People's Action, and being able to take a couple hundred or 1,000 people to a company office and using it as a way to confront that company and demand meetings with decision makers. Usually they hide behind the kind of rank and file workers, and we want to upset that balance of power. So the escalation arc, basically, one, our local groups are power mapping the insurance companies in their turf where their members are having problems. We're going to use their process, file appeals to claim denials. We're going to demand meetings with local company leadership. And then we're going to call out the local company leadership. Many of you all know, but just to say it concretely, this works. We connected with a woman last week who ran a campaign on behalf of a friend in Oregon. I think somebody was here from Oregon, and talked about the initial denials that they got, and even appeal denials. And of course, the insurance company, once the targeting got to the CEO and to board members, and a public campaign, issued a compassionate care override of the even denied appeal. And so we just think this works. Doing rallies and direct actions at the local insurance company offices, and then moving to their HQs. And we've been started kind of listing out and engaging with stock analysts and investment firms behind these companies, because we think that they're potentially a unique pressure point. Now, all of this is sometimes to move the insurance company to do the right thing on a specific claim denial, but even more so, it's to make public and kind of toxify their brand. One specific tactic that you can engage in anywhere across the country is the text banking, where we're reaching out and looking for people who have been hurt by their insurance company. I'll put in a link, or if Robel has a chance to now, we're going to be doing this again on April 13th. We've reached out to 80,000 people so far using this methodology, and it's kind of crazy. I mean, lots of people, don't want to talk, and I've gotten people who are like telling kind of their intimate stories of how they've been harmed recently by a health insurance company, because this stuff is raw for people. And we're going to use other methodologies. We'll invite you all to join us in as well. Okay, so I'm going to take a second to dig into claims denials. And this is one way that insurance corporations put their profits over our care. They issue millions of them throughout the year, over the course of 1 year. It's where they, as you all know, refuse to pay for the care, medication, or treatment we need, and that we don't get it. And so I'm going to stop sharing for a second and just see if I can get in chat or by raising hands, who here has had a denied claim or a pre-authorization denial in the case of the last year? What happened to you? See if we can get it in chat or raise your hand. Denied claim or pre-authorization denial. Okay, I'm seeing Aisha say I have, other folks in chat. Patty Beverly is saying that she has, or that a friend, Patty, has. All right, else has had a pre-authorization denial or claims denial, or had somebody that you care about experience that? Seeing Brenda raise her hand. Brenda, would you mind coming off mute and sharing what happened to you or somebody you care about?
Sure. Now, for me, this is small potatoes. Well, actually, I don't have much income. But it's a part of a great big picture of bad work. So it has to do with this in-network, out-of-network stuff.
Yep.
That's one that hasn't hit me before. So what's happened with Medicare and Medicare Advantage, this particular Health Net's the name of the insurance company out here.
Okay.
Anyhow, supposedly we suddenly in 2022 have dental. We've got dental, we've got vision, they threw it all in. Well, the tricky part is, though, they didn't throw in any network. There are no network providers. They talk about how they'll pay 70%. If you find a network provider. So I started having conversations with them back in November when I saw it in the benefits comparison book. I phoned them a couple times. Finally, they sent me the directory. They tell me this directory is effective February of 2022 for the entire state. Okay, 1,000 pages in 2 volumes. I go through this thing. Of course, there's no one in network because they couldn't tell me over the phone who was in network. There's no one from any place in Southwest Oregon. And the plan just covers certain parts of the state. So there's also no one in Portland. There are no dentists up there who are so in any event, right now, anyway, I went to the dentist anyway, and I'm just today actually writing an appeal to them.
Oh,
and
good.
Strategy beyond that, they want to deny me on that. I'm going to tell them right away in my appeal that I'm going to talk to the insurance commissioner about this too. We actually, the past years ago, we had some helpfulness from our state insurance commissioner.
Okay.
So that's what's happening with me.
Thank you so much for sharing, Brenda. And yeah, that story of essentially like they set up a plan that actually can't work because there's no in-network providers is all too frequent. Can I ask Diana to come off mute and share with you an example of the denials you've encountered as a PCP?
There's so many, it's kind of hard to know where to start. So I'm also in Oregon. I work in Tualatin, which is kind of a suburb of Portland area. I've also worked in Columbia County. So a couple of examples. So I used to work up in St. Helens, which is a rural practice, somewhat north of Portland. And one of the Providence insurances decided to start offering insurance to people in that county, even though they didn't have any healthcare provider clinics set up that actually took Providence insurance. And I work for Legacy, and we are a competitor system. So there was a deal that was done behind closed doors where Providence patients could be seen in our clinic, so they could see a doctor, but there's also no place to do labs and x-rays that takes Providence insurance. And so people would come to our building, they'd come in, they'd want to do a physical, like with a pap smear. Well, we use Legacy Lab, we don't use Providence Lab. So then they would get the bill, we'd have to tell them, hey, I can do your exam, but I can't collect your pap because we use Legacy Lab. I don't have a way of sending it to Providence. You can't do your mammogram in this building locally because it's a Legacy mammogram. You have to go travel into Portland, 45 minutes into town to do anything. If we want to do a lab work, say you have a urinary tract infection, well, we could do the pee sample here, but then it's not covered under Providence Network because it's not that lab. So that's just one example of where it can go completely stupidly wrong.
That is incredible. And it's the hybridization or the separation out of I forget somebody was saying at the beginning, like, we want to just think about our total care. What we need is human bodies. And they're separating out even within one care intervention, what will be paid for in network and what won't. That's both a horrible and perfect example of the problem, Diana. Can I ask, is anyone here successfully appealed a denial? Is anyone here who has successfully appealed a denial? I'm seeing a nod as well from Diana. Do you want to say, can you tell us the story? Can you tell us just the bullets of the story?
I think the successful appeals on the end of what we do kind of depend on what it is. So there are some appeals that happen that are easier to do because it's a matter of changing a billing code. So this is something that I think a lot of people don't know that goes on the back end of, say, doctor's visits, is that when you see your doc and like you're there for a visit and they order some labs, when you are the person putting all the inputs in at the time of the visit, occasionally you cannot click a certain button. This sounds crazy, but you can like miss clicking a button and all of a sudden it goes from something that is paid for to something that isn't. Those are pretty easy to correct on the back end, but it also means that the patient has to recognize that they have a benefit, like if it's for, let's say, a physical, because this is a common thing that comes up, and they have preventative care benefits, and if you bill the right number of the code, then that lab should be covered. So some people have enough awareness that they go, hey, this actually should have been paid for, but they have to recognize it and be aware. And so that's another problem, is that a lot of people just kind of pay for it because they don't know that it's something that they can actually appeal really easily. Of course, it shows that our system is just broken enough that you have to appeal it. It just should be paid for, period.
Yeah.
Yeah.
Well, this is a perfect example. Thank you. Thank you, Diana, because it is the kind of the perfect segue into why we think organizing people around claims denials could be so powerful for our movement. So let's just take a look at scale. So these are just some example numbers from a couple of years ago. So in 2019, 122 of the insurance companies, you add up those folks, they denied 17% of all claims. As one example, for Beverly in New Hampshire, that rate was 31, almost 32% of all claims submitted were denied for the huge variety of reasons. And if you think about it as a total, that's about like 40 million people if you just took the in-network claims, not even the out-of-network examples that we're hearing. And those 40 million people got stuck with a huge bill, or they didn't get the care or the medication that they needed. And then if we think about that as a total, then we start to think about, well, everything that Diana was just saying about the appeals process, right? Well, so they're only supposed to issue claims denials when the care or medication you request is not covered by your summary of benefits. But sometimes, and we know that they shouldn't even do that, right? Because this out of network, all that stuff is ridiculous. We can fight that too. But sometimes insurance companies issue claims denials even in violation of their explanation of benefits for care they are supposed to help pay for. Some of that can happen in the example that Diana gave because of miscoding. Some of that can happen because they de facto give quotas to people who are processing the claims. And when we think about it as a total problem in 2019, let's use that as our sample year, only 0.2% of people appealed a claims denial. And we think that rate is way lower than the number who should appeal or who could get an overturn upon an appeal because the denial happened in violation of the summary of benefits. And so why is it only 0.2%? It's for all the reasons that you all listed. It's opaque system. The insurance company, in a way, ends up being partially a ref as well as an opposing team. It's not always true that the appeal panels are people who have expertise in the given area that they're reviewing claims on. And extraordinarily infrequently do they include directly impacted people who have actually had kind of life experience around an issue. So this is why we think sort of organizing a set of people who are harmed by private insurance on claims denials, supporting them in appealing, even while we run social pressure campaigns on the companies to greenlight the appeal, is an effective strategy. I'm gonna, let's see, sorry, next moves to kind of make this happen. So we'll dig into this more in a second. But we're doing our next text bank, reaching out to people in 2 weeks. I think Rebel put it in chat, so you can sign up there. But I'm going to pass the mic to Rebel to take questions from from you all about this campaign, and then we're going to break out because we'd love to dig in it more. And as you know, you all have been organizing around Medicare for All, and in some case for decades. Some of you are part, been medical workers as physicians and nurses, CNAs, other roles. And so we'd love to dig in and get your feedback on how you think we could build out this strategy in your geography. So we'll break out to do that. But first, just general questions about the campaign. Going and checking on chat, I'm seeing Ken saying another important factor is whether the doctor will back up the appeal. Can you say a beat more, Ken, about that? And then we'll go to Patty.
I worked as an RN case manager for workman's comp cases. And so it's always dealing with the insurance company. And it mattered who your doctor was, not just as far as whether they were good in their practice, but whether or not they would put the time in to, to fight denials.
Right. And so it's literally whether they decide they're going to spend that bandwidth of their time is a factor on whether you're going to get the backup to get the care that you need. I think that's a good point, Ken. And an overlay I'd put on that is, frequently race and gender. Some of that's about the time that they put in. Some of that's about whether they're going to believe the stories of a need for care, and that can, have huge racial and gender overlays. Let's go to Patty. Patty, kind of questions on the campaign.
I guess it's a kind of question comment. The whole purpose of revealing these bad actions of insurance companies is to toxify them for the public understanding. And I wonder why there is not more publicity about the nefarious, illegal, and fraudulent practices of insurance companies, particularly Medicare Advantage and other related schemes that use upcoding to defraud the Medicare trust fund. And they are fined billions of dollars in fines for this behavior. And the federal government collects very little of that. And yet they consider that to be the cost of doing business. It's just a slap on the wrist, but it is so vilely fraudulent and illegal and criminal that they're destroying our Medicare trust fund that is supposed to be there for us when we're in need of it. It is so shocking to me that it should be blasted across headlines everywhere.
It's really true. And yeah, I'm seeing, Melissa, your comment chat. They don't care because we're the ones paying the fines. And yeah, I think it's, for us, it's like, two reactions to what you're saying, Patty. One is that we absolutely think that the way in which, kind of Medicare Advantage and, just a bunch of different aspects of the system are, kind of increasing the power of the private insurance industry, even over kind of programs like Medicare. We absolutely see that as core to this fight. And one of our member organizations, Jane Addams Seniors in Action, explicitly organizes folks who are 65 plus around these issues because they're getting hit too, the way the system has been twisted. Other kind of questions or comments before we
just to kind of add on to that in general, in terms of like why these stories don't necessarily get highlighted. I think I can't remember who said it earlier, but a lot of times we deal with these situations alone, right? Like we might tell a couple of family members, a couple of friends, but a lot of times the way we react to these things is from a place of powerlessness. Like I know that's how I felt when I was going through that situation. And for me, when I hear something like that, that just calls the need to be moving together around this and to understand that, like, you're not the only one who's having their lives impacted by a private insurance company, right? You might have a neighbor you've never spoken to as dealing with somebody like something like this, a friend who's like keeping this close to the chest because it's shameful or they feel that way, right? And so that's part of the kind of the how do I say, public aspect of the campaign is like, we don't want to just highlight one story, but we want folks to understand that this is happening everywhere.
Right on to that. Yeah. And our thought, can I ask, actually, has anyone here on the call been involved in a direct action before, where you were part of a group of people who were confronting a bad corporate actor and decided as a group to kind of step on the grass, as it were, and show up uninvited to demand a meeting with a public official? Can I see a raise of hands or in chat? Has anyone had that experience before? Robel, Brenda, Cian. Brenda, you mind taking a second to tell us the story of that for you all?
Oh, well, that was what comes to mind was Walmart and wanting to meet with the manager about the treatment of employees. Let's see, I can also think of our congressman, one of our past congressmen, and wanting to meet with a congressman. Actually, I was part of a group that that got arrested for that. Myself, I wasn't, but anyway, half a dozen people were in the congressman's office.
That's awesome. Well, I'll tell you one quick story, and then I'd like to, I'm seeing a couple others in chat, so maybe I'll say to Aisha, so that is one of the tactics or strategies that we're going to be using in this effort. And the reason we deeply believe in it at People's Action is we think that the way that decisions are made that are harmful for so many of our lives is that the actual decision makers and the beneficiaries, whether it's the investors in corporate health insurance companies or even the CEOs and C-suite folks in the technically non-for-profit companies, are really hidden from any accountability for their actions and for the suffering that they cause. And so we really believe that we want to show the pain that we're experiencing to the folks who brought it to us. One specific example in the Medicare for All fight with our allies there at Iowa Citizens for Community Improvement, during the campaign, we thought that Vice President Biden and Mayor Buttigieg were lying about Medicare for All. And ran a couple ads in the Des Moines Register calling them out on those lies and demanding that they meet with us. They wouldn't meet with us, wouldn't respond. So we took 30 people to their offices and said, we're going to occupy this office, nonviolent civil disobedience. And even if it's closed, we're going to stay here. And it took about 3 or 4 hours. But we got their senior staff on the phone. And I think it's, sometimes we got to increase the tension, folks. Can Aisha, I'm going to pass the mic to Aisha, and then looks like William's got a comment after that. So Aisha, do you want to just, you have a story of executing a direct action to get a change?
Yeah, I'm trying to think of the best example because been part of a lot of them. I mean, I don't know. I think your story is better, Ryan. Like, we did an action at Pharma this September as part, in the Build Back Better negotiations. There was all this kind of industry propaganda about, oh, we need to be giving more money to the pharmaceutical companies so that they'll keep innovating new drugs, and we can't allow Medicare to negotiate drug prices and all this stuff. And we took a group of, it was only about 50 people, maybe 100 people, to the lobby group's headquarters and did an action outside, calling out the members of Congress who were just acting as puppets of big pharma, with some visuals. And Bernie was there talking. It was one action. We obviously did not move pharma, but we did, I think, move the conversation that was happening around the issue, because we're calling out the members of Congress that were just kind of parroting the pharmaceutical talking points. We drew attention to that fact, and it made it harder for those pharmaceutical companies to keep getting away with that, and for the members of Congress to keep getting away with that, because it was clear what was happening.
That's awesome. And so, in some cases, the kind of strategic theory of the direct action is because we want to actually bring somebody to the negotiating table. In some cases, like the example that Aisha gave, the strategic theory is that we want to generate press and pressure on another actor. So in that case, Congress, even though we know that pharma is not going to give up their evil ways, we know that the press will, cover intensity of disagreement. And so, for example, when the members of Iowa CCI occupied Vice President Biden's headquarters in Iowa a couple of days in advance of the precinct caucuses, they got on numerous TV channels and were able to tell the story of why they thought that Vice President Biden was lying about Medicare for all. And we think that that was one contributing factor to his loss in the Iowa caucuses. Although obviously he was better than Trump, so we supported him there. Was that what you were looking for the kind of strategic theory, William, or were you wanting to comment in a different way? So William Bronston, I saw a chat.
I wanted to address the larger question, Ryan, because I think the issue here is so challenging. I don't know whether this is the right time that you want to allow a larger comment around what we're talking about here, or whether you want to continue focusing on this particular tactical work that you're doing right now.
Good question. I think let's do this. Because we do want kind of comments about how this fits in the overall strategy, and are interested in your feedback on this specific campaign as well. So what I think we should do is but we wanted to make sure that we had a chance for kind of everyone to talk and participate. Right. So I think we'll move to breakouts. And Rebel, do you want to set us up there? And I think we'll have kind of different facilitators for those breakouts. So hold the comment, William, and then we'll
how much time do we have until we're finished altogether?
We've got a half hour until we're finished.
Right. And so, all right, because I'd like to address the large question of care versus cost, and the whole strategy of how we're going to break the bank here, how we're going to deal with this thing.
Yeah, we'll go to breakouts, and then you can address it there, and then we'll bring back together as a full team to debrief, and you can address it there as well. So there'll be two bites at the apple, as it were.
Thank you.
You betcha. So as folks go into breakout, we're going to do two teams, one that Rebel is going to lead, and then I'll lead the other. Our kind of purpose on our end is many of you all have been involved, explicitly in the, kind of way that healthcare operates as a system in America. And so we want your feedback on this strategy and the moves that we're making around claims denials and pressuring of insurance companies. But then certainly, as William was flagging, if there's kind of broader thoughts about how this relates into the overall strategy of Medicare for all, or an even bigger strategy of how we center care in our world, that's totally great. Oh, I'm getting a flag on time, so we'll do 10 minutes for the breakouts, and then we'll regroup together. So sorry about that, Rebel. I should have said 10 minutes for the great, and then we'll have 5 minutes to debrief and do the eval.
Cool. Then with that, I'll open up the rooms. See. And then, you should have a notification allowing you to join a breakout room you've been invited to. Okay, make sure folks are good on this end. Okay, then I'll see y'all in a little bit.
Welcome back, everyone. Welcome back. As our compatriots in the other room rejoin us, we're going to take just a couple minutes to evaluate. Our philosophy is at People's Action is anything worth doing is worth evaluating. So we want to make sure to get a sense from you all, during this workshop session, what you found kind of beneficial and what you might look for in the future. We're actually going to be running it again tomorrow, and obviously are going to be continuously building out this campaign in the coming time. So excited to keep engaging with you all. I was flagging for people. I'll send an email around after the session with some of the follow-up links as well. So there'll be a way to get in contact with us directly and follow up after the session. It looks like our compatriots are coming back from breakout room 2. I know this is always too short, and I lost track of the ending there for a second. So I think I would have moved us to our breakout discussions earlier if I had tracked as well. But welcome back, y'all. And I'm going to pass the mic to Rebel to lead us in an evaluation.
Yeah. I was taught this my first day organizing. Anything worth doing is worth evaluating. And so I'd like to end us with an evaluation. And so just because we got kind of a set of, people in the room here, maybe not necessarily a chance for everyone to speak, but we're going to use the chat to kind of facilitate this. I'm wondering if everyone can share one feeling word, something you're feeling in your gut after this workshop. And then I'll call on a couple of people to unpack. Give me one word. How are we feeling right now? Okay, we got possibility. So William's dreaming. I like that. Melissa's excited. Diana's maybe hopeful. Empowered, open, doggedly determined. I like that. I might second on that, Patty. I'm going to steal that one. Motivated. All right. Does anyone that shared something like empowered, doggedly determined, motivated, would anyone like to unpack that for the room? I'll call on Patty Harvey.
Well, I would just say, sometimes it seems like impossible that it's somewhere you can never really achieve what you're hoping for. On the other hand, what are you going to do? Not do anything? There's no choice here. It's a pretty clear imperative that one foot has to go in front of the other, and step by step, you do what you can.
Yeah. I'm curious about Diana, your questioning hopeful, if you'd like to unpack that with us.
I guess it's just one of those, the fatigue of 2 years of being in healthcare in a pandemic and going, well, maybe, it's time for the system to finally change. And it's very reassuring to know that there's other folks out there who want to see that through. So hence the hopeful, it's going to be a long battle, but at least, we've got people who are wanting to engage.
Yeah. Thanks, Diana.
Mm-hmm.
Can I get one more from that kind of sector of feeling word? Excited, hopeful, empowered. How about Faith? Would you be willing to share with us?
Yeah, I was putting in the chat, but yeah, no, I've been volunteering for Medicare for All for a few years now, and it has been really unsettling to learn that the federal government's they've been doing kind of trial runs of Medicare Advantage is a privatized Medicare, but it was more broadly being studied about how to privatize it, and even Biden is working on plans to privatize Medicare. So that was pretty disheartening to find out that we could do this, maybe push it forward and then still end up with private insurance. So I think the only way is to somehow figure out how to dismantle the insurance companies.
All right, so the next part of our evaluation, I want to hear about the tensions that folks are feeling. So tension isn't necessarily a bad thing, but it's that thing you get in the pit of your stomach that makes you want to do something, right? That's why we're all here, because we feel tense every damn day. And so I'll start with Heather. I saw your feeling word is impatient, which might lead into that a little bit. I'm wondering if you could share with us.
Yeah, I just, I know a lot of people have been doing this a lot longer. I'm one of those people who's been on doors talking to people for like 7 years, but doors to hit the streets, I guess you could say, but probably at least somewhere in the tens of thousands. I don't know. I don't want to measure it. And it's like been such a challenging issue to organize and like base build around kind of what we're talking today. So it's like, I guess frustration kind of with impatient. It's like, we have so much will, like in general, Medicare for All does have, even with these 70% numbers, Medicare for All has over 50% support, but like not being able to, the like people talking about Biden, we all know he hates Medicare he said not to vote for him. I wish Angie from CCI were here. He literally said that to one of my friends. at an event here, not to vote for him if you wanted Medicare for all. And so anyhow, just systemically, it's like people do want it, and like we shouldn't all be have to die. Like basically, it's like how many people are gonna have to die for us to get it?
Yeah, so feeling real urgent around this. And I see Beverly shared the word frightened. I'm wondering if you could unpack that for us.
Well, it's a very personal issue, as it is for everyone. I mean, our healthcare is the most important thing. I said this earlier, try to keep it from being so personal, but you can't do anything unless you have your health, so it's the most important thing. And I just feel like if it's going to continue to be driven by profits, which we've talked about, if it's going to be continued to be driven by competition, then we're going to lose healthcare. And I've already think we have with the pharmaceutical things that are going on. I didn't watch TV for like 10 or 15 years, and then suddenly we got a little bit of a YouTube subscription, and we're on there, and I'm like watching the commercials, and every commercial is trying to sell you some new drug. And they're really driving, and there are people that buy into that, and I don't know what it is. Like, it's like we got along fine. My grandmother lived till she was 87, and people living 100 years old, and they're not on these drugs. Why do we need these drugs? I mean, it's just so much deeper than that. I just feel like sometimes the privatization has gotten us away from real genuine healthcare. Sorry, but that's how I feel.
No, I think that's spot on, right? Like when we center our healthcare system around like what's optimal economically, or like how can we generate the most profit because that's what makes sense, we've lost the plot, right? Like that's not what healthcare is. So yeah, thank you for sharing that, everybody. But I don't want to leave us on that note. So what are folks leaving with today that's making you feel a little inspired, a little amped after this? Go ahead, Melissa.
Yeah, no, I'm finding this extremely inspiring, extremely exciting, because I'm seeing lots of really good concrete things that my particular little group, which is Portland DSA Medicare for All campaign, like we couldn't do this on our own. But I really want to make sure that we are part of this, because I think we have so many new members that come in all the time, and they say they're interested in Medicare for All and they want to do something, and so there's good concrete things here to keep people engaged and connected. And I'm just, I hope to talk more with all of you. I find this really exciting. So thanks.
And then I think with that, I'll close this out. Thank you for sharing that, Melissa. We win together, right? And when we're kind of off in our silos, that's when we've lost. And so I'm looking forward to building with everyone in this room. Earlier in the chat, Ryan shared the link to one. If you want to join us for text banking, there's that Mobilize list, or Mobilize link rather. You can find some of our events so we can reach out and have these conversations with folks that are dealing with these claims denials. And then the other link, Ryan just reposted the links. The second one is a survey. So, folks have been courageous today in this workshop and sharing their stories with their insurance coverage. And the more that we're able to show folks that they're not dealing with these things alone and from a place of powerlessness, that gets us closer to the vision of the world that we want to see. So I'm encouraging everyone to share your story with us and let folks know that they can do that, and that's part and parcel of how we win. So thanks, everyone. And I know there's another session to get to, and so yeah, with that, I'll close this out.
Thanks all. Great to meet you. Go team.
Thank you, everyone.
Part of the people.
Thanks.